be your nurse today. I'm gonna clean my hands. I'm gonna give us privacy, and I'm gonna ask you for your name and date of birth and why you're here today.
Hi, my name is Pedro Diaz. My date of birth is 11/14/2003. I'm here today because my head hurts a little bit, and I'm here for a wellness checkup.
Did you hit your head?
Yes, I hit my head.
Where about?
In like the center of my head, a little bit to the side.
Okay. And what's your pain from 0 to 10? 10 being the greatest, 0 being none.
6.
Is it throbbing?
It's from time to time.
So it's 6.
Mm-hmm.
Did you take any medicine for it?
Ibuprofen frequently.
Okay. When's the last time you took ibuprofen?
This morning.
This morning? Okay. So by speaking to her, I see that she her speech is clear and no slurring. Also, she's dressed appropriate for the weather. She's alert and orientated ×3, which is person, place, and situation. Her skin looks good. There's no blemishing. Her skin looks like the appropriate for ethnicity. She's dressed for the occasion. She's groomed well, and she speaks well. So what I'm going to do today is give you a full assessment. That's from head to toe. So it's going to require for me to listen to your heart, listen to your lungs, feel on your stomach, feel on your different parts of your body. Is that okay?
Yes.
Okay. So you say you hit your head. So right about back here.
Yes.
Okay. I'm gonna start off with taking your vitals. Is that okay?
Yes.
Second. Okay, relax your arm. Just relax your arm. Okay, her blood pressure is 130/78. Okay, now I'm going to check your pulse and your pulse ox. We'll put on this device, the pulsometer, onto your finger. Let me see this hand. Okay. I'm going to check her pulse. Her pulse is 84. Pulse ox is 99. Listen to your lung sounds. So I'm going to listen to 6 places of her lungs in the front and 6 in the back. When I place this on your chest, just take a deep breath. Good. 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 Can you lift this side up? No. On this. Take a deep. Oh, good. Good. And now I'm going to check her back. 6 places in the back. Take a deep deep breath. Take a 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 deep breath. Good. Her lung sounds good. I don't hear any crackles or rattles or anything in her lungs. In the front and the back, it seems like she's breathing deeply. And I hear no sounds, and like I said, no problems in her breathing. Now I'm going to check her pulses on her chest. She has 5 spots on her chest, so I'm going to listen to your heart sounds, okay?
Yes.
The aortic, palmatic, herbs, tricuspid, and mitral. And now I'm going to listen to this for 60 seconds. .68. Heart rate 68. Okay. Now I'm going to check her head. So is that okay if I touch you, ma'am?
Yes.
Check her head. I don't see any soft spots. Tell me if you feel anything. Feel something back here?
Yeah, right there.
Okay.
A little bit.
It's a little sore. Her head looks symmetrical. Is round. There's no bumps, no scarring, even in the place where she said she hit her head at. Now I'm going to look in her ears. Shine the light in her ears. Her ears look clean, clear, no bruising, no red, no discharge. And check her other ear. Pull back. And on this side, I don't see anything either. No bruising, no redness. Do you wear hearing aids?
No, sir.
No? Okay. Now I'm looking at her face. It looks symmetrical. There's no drooping. She's looking at me straight. Everything looks good right now as far as her face structure. Now I'm going to shine this light on your right eye. And then I'm going to cover this side, and then vice versa. I'm going to go the other way. Okay? I don't need you to blink. I just need you to look. Look straight. Okay? Her eye is equal, reactive to light. Now I'm going to do accommodation. So I just want you to follow this pen light with your eyes. Do not move your head. Okay, everything looks good there. Now follow the pen. Do not move your neck. Just up and down, just with your eyes. I'm going to go up, down, left, and right. Ready? Okay, so both of her eyes are good. They're pearler basically. Now I'm going to check her peripheral. Tell me, raise your hand when you see this pen light. Okay. The other side. Okay. So yeah, both her eyes look they look good. React to light, symmetrical, and her peripheral is good also. I'm gonna check her nose. Can you lift your neck back, please? Okay, her nose is clean and clear. No deviated septum. I don't see any polyps. Do you have any problems with your nose?
No, sir.
Okay. Now I'm going to check her mouth. Can you open up your mouth, ma'am? Say ah. Say ah. Say ah. Okay. Do you wear any dentures? No?
No, I just got my braces.
Okay. Her mouth looks good. Her mucosa, it looks nice and wet the way it's supposed to be. I also need to check her temperature. So give me 1 second. I'm using a temporal measure temperature because I don't have one for her mouth. And it's 97.6. So now I am going to her arms, well, to her neck. We check her carotid. And it is good, it's regular, not bounding. Same thing on this side. Okay, everything is good on both. Both carotids are good and I feel the pulse. Okay, I'm gonna ask you for you to look to your left. Look to your left. Then look to your right. Look up. Look down. So her neck has range of motion in all 4 directions. There was no pain with it, right?
No.
Also, I saw that she had no extension in her jugular, which is good. I'm gonna check her for dehydration. I'm gonna do the skin turgor. And it went back within a second. Now I'm gonna check her range of motions of her arms. Can you extend your arms out? Can you go rotate them? Can you go up? Can you go forward? Okay, bring your elbows together. All right, when I push towards you, you push out. Okay, okay, when I pull, you pull. When I pull, you pull, good. And now push. Good, she has strength on both arms, both bilateral strength and range of motion. You can put your arms down, range of motion also. Now I am going to check her pulses in her arms, brachial pulses, to see if I feel them, and I feel them pretty good. I'm gonna check other pulses, radial pulses, bilateral, they are good. They're good. I'm gonna check her fingernail beds to see if the blood comes back within 2 seconds, and it's good. Good. So both arms are good. Circulation is good. And like I said, well, skin seems warm to the touch, not clammy. So her skin is okay. Both extremities all right. Okay, now ma'am, I'm gonna have you sit down, lay down on
My back?
on your back,
Or my front?
on your back. And I'm gonna check for stomach sounds. Okay? So looking at her stomach, I don't see, it looks pretty normal, nothing abnormal. And I'm gonna listen to her stomach bowel sounds. I'm going to the upper right quadrant. Upper left quadrant. Bottom left. Bottom right. I'm supposed to listen to this for at least 2 minutes each quadrant and 5 minutes total. Now that I listen, I don't hear much. I hear just a little bit, which is good. And now I'm going to palpate her stomach. Going to the top right quadrant. Tell me if you feel any pain or if you feel anything.
Okay.
Okay, or any discomfort. You okay?
Yes.
Okay. Anything there?
No.
Anything here?
No.
Okay, I checked all her four quadrants. I do hear some sounds. I didn't feel any masses, no sign of hernia, no pain or discomfort. Now I'm going to check her femoral femoral pulse, and that's right here in the inner area, and femoral, I feel both. Okay, now I'm going to do and check her popliteal, which is behind her kneecaps. If you can slide up just a little bit, ma'am.
Sorry.
Okay. Relax your legs. Okay, I feel both. Bilateral, I feel both of them. And it's fair. Okay, next I'm going to check for edema. And there's no sign of pitting edema on her right leg. And no sign of edema on her left leg. Now I'm going to check her her dorsal pulses in the front, in between the big toe and the little toe, and slightly up. And I feel both of those. Now I'm going to go to the dorsal, to the dorsal pedis dorsal, which is in the back, inner, right under the bone, ankle bone. And I'm trying to locate that. And I feel both. Both are there, and it's not bounding, they're fair. So all pulses are good. Now I'm going to check her range of motion and her leg strength. So I'm going to need you to lift both your legs up. Okay, bring them down. Bring one out slightly and bring the other out slightly. Okay, now you can sit up. Come here. Just stand right there. Please stay seated. I am going to check your strength. So when I tell you to lift your knees, I'm going to press down, you lift up. Lift up. Okay, good. Okay, I'm going to push together, you're going to push out. Good. And lift your feet up. And when I press up, you press down. Good. All right. And let me see the rotation of your feet. Stick your feet out and rotate them. Okay, so she has her extremities, she has range of motion and strength. When I press down. Okay, great. So that is my full body assessment.